How would the Senate Republicans' health care bill impact Americans? The Congressional Budget Office score paints a mixed picture. Here's what you need to know. The CBO estimates that over the next decade, the Senate bill would leave 22 million more people uninsured and reduce the federal deficit by $321 billion compared with the current law. That's seen as a slight improvement from the House bill, which is estimated to leave 23 million uninsured and reduce the cumulative federal deficit by $119 billion through 2026. The CBO also estimates that under the Senate bill, premiums would continue to rise in the next few years, but would decline after 2020, and insurance markets would continue to be stable under the legislation. The high number of uninsured could make it politically challenging for Republicans to find the 50 votes needed to pass the Senate bill and move toward dismantling Obamacare. Remember, Republicans have a 52-seat majority, but a number of GOP senators have expressed reservations about the bill, known as the Better Care Reconciliation Act of 2017.
Today, I don't have enough information. I don't have enough data in terms of the impact to my state to be able to vote in the affirmative.
It's hard for me to see the bill passing this week.
And I'm not voting for something that looks just like Obamacare and still doesn't fix the fundamental flaw of Obamacare.
Like the House bill, the Senate's plan would repeal taxes imposed by Obamacare, end penalties for people who don't have insurance, and reverse the expansion of Medicaid. It would also curb overall Medicaid spending for the first time. And there's a provision that penalizes people who let their coverage lapse for 63 days or more by requiring them to wait 6 months to buy another plan. Moderate Republicans say the bill goes too far, and conservatives say it doesn't go far enough in repealing the Affordable Care Act. And no Democrats or independents are expected to support the bill.
The truth is that this so-called health care bill is nothing more than a massive transfer of wealth from working families to the very, very rich.
Senate Majority Leader Mitch McConnell says he plans to call a vote on the bill before the 4th of July recess. The White House has cast CBO numbers as unreliable, and President Trump tweeted that he's very supportive of the Senate bill, though he may have complicated efforts to overhaul Obamacare by calling the House version
mean. That was my term, because I want to see, and I speak from the heart. That's what I want to see. I want to see a bill with heart.
So what are your thoughts on the Senate's plan to repeal and replace Obamacare? And is their bill better than the House's? Let us know via Twitter, email, or leave us a comment on Facebook.